The following is paid advertisement and does not reflect the opinions of this station. The choice of a lawyer is an important decision and should not be based solely on advertisements. The information presented in this program is general and is not intended to be legal advice and should not be relied upon or used without consulting a lawyer to consider your specific circumstances.
Questions about law, stories from the courtroom, cases that might impact your life. It's time for Tell Me I Have a Case with Dan Grimm and Matt Glenn from Cook, Barquette, Ponder, and Wolves. Find them at cbpw-law.com. Here's Dan Grimm and Matt Glenn.
Welcome to another episode of Tell Me I Have a Case. I am Dan Grimm with the law firm of Cook, Barquette, Ponder, and Woltz. Our show is broadcasted once a week, every Saturday morning at 7:30 a.m., where we'll be inviting you to take a second look at the world of personal injury litigation. Last week we had on the show Dr. Chad Armstrong, who's an ER doctor with St. Francis Medical Center. Today, we're pleased to have on the show Andrew Bulow. He's a physical therapist and owner of Advanced Training and Rehab. Andrew, welcome to the show.
Thanks for having me, Dan.
Hey, why don't you tell the viewers a little bit about yourself?
Yeah, so I was born and raised here in Cape Girardeau, attended high school here. I wanted to get away a little bit for college, so I went up to St. Louis, played a little soccer, got my undergrad and graduate degree up there, worked for a few years, and then decided I wanted to come back home.
Well, let's talk about being a physical therapist. What kind of education, schooling classes you got to take?
Yeah, nowadays you have to have a doctorate. It used to be you could have a bachelor's, and then it was master's, and now you got to have a doctorate. So you do your 4 years, get your undergrad, and then you start your the program I went to actually started your graduate work in fourth year. So
wow,
yeah,
wow. So a doctorate, how many years is that?
6 to 7 years, depending on the program.
Man, a lot of schooling. For people that don't know what a physical therapist does, why don't you just give a general background on what a physical therapist does?
So we're trained as movement specialists. So our goal is to analyze the body and figure out how well it's moving, if it's moving well, if it's not. And then if it's not moving well, how do we fix those problems?
Okay. A large part of our practice is personal injuries from a motor vehicle crash. What injuries do you often see that come through your door from people involved in personal injuries from a motor vehicle crash?
I see a lot of spinal injuries, of course, neck, back, sometimes these shoulders. I've seen some people with burns. I've seen people with knee and ankle injuries. So it can be really anything depending on how severe the accident was.
And I'm assuming that you see things from a wide range of sprains, strains, all the way up to something that may be post-surgical.
Mm-hmm.
I think a lot of times people hear the term sprain, strain, but they don't really know what it is.
Right.
What's your definition or the medical definition of a sprain, strain?
Right. So a sprain involves ligaments. A strain involves tendons. So a ligament connects bone to bone. So more common injuries, people think they're ACL. With baseball, you've got your Tommy John, the UCL ligament. With strains, that's connecting tendon to bone. So a muscle is connecting by the tendon to the bone. So that's the difference. Ligaments, bone to bone, tendons, or muscle to bone.
Okay. I always think about someone that pulls a muscle. What's that called?
Strain.
Strain.
Mm-hmm.
Can a pulled muscle be torn?
Yes.
Okay.
There are different grades. There's grades 1 through 3. Grade 1 is the mildest to a slight tear. Grade 2 is somewhere in between, and grade 3 is a complete rupture.
Okay. And same thing, I always think about, someone that has an ACL that's either stretched. Is a stretch, is that a tear, or is that something different?
That would be a sprain. Same thing. There would be the grades 1 through 3.
There's a fly in here. And with that being said, I always think about, a lot of people, they get these injuries and they hope they'll go away. Mm-hmm. Is there something, medically speaking, it's better for someone to see you sooner than later, and why is that?
Yeah, there's all kinds of injuries that, you might have like a simple sprain or strain, like a grade 1, to where maybe just give it some time. Your weekend warrior, you might just kind of step funny. But if it's kind of like a repetitive overuse type injury, or if it's significant enough to where you can't get around, you can't reach overhead, you're having a lot of clicking, popping with pain, that's something that needs to be addressed sooner rather than later.
Okay. And I'm assuming then, can someone just see you, call you and see you, or are they referred by a doctor?
They can see us for an evaluation. So they would walk in the door, we could evaluate them and see what all's going on. But to treat them, we have to have a prescription from a doctor.
Okay. And that'd be typically their primary care doctor or ER doctor?
Primary care, orthopedist, chiropractor, podiatrist.
Okay. So a lot of our our clients we see have spinal injuries. A lot of them are low back injuries. I see them come in after a motor vehicle crash. There's situations where they have a hard time sitting. They have a hard time standing after they sit down for a while. When I see them when they get up, they have a hard time standing straight up. What's causing that pain and that lack of range of motion?
Could be a few things. The spine is very complex. We've got our discs, we've got our vertebrae, we've got nerves. There's a lot going on. So sometimes it can be a combination of maybe they have a disc issue. So if they are trying to lean forward, that can actually put pressure on the disc, which can then apply some pressure on the nerve, causes the pain. It could be a facet where the bones meet in the back. They need to open and close, and sometimes they don't open or close very well. So that can also cause some problems with transitions from sitting and standing.
Okay. Is part of your physical therapy and training, is it working on core stability?
Yes, absolutely. So with us being movement specialists, we want things to move well, but we also want them to be stable too. So not only do we focus on stretching things, we focus on strengthening muscles as well.
Okay. And what muscles are we looking at as far as, I always think about it, somebody has six-pack abs.
Right.
Does that matter?
Not necessarily. They're not necessary. We all get, a lot of us, you and me, we get by throughout life without a six-pack.
I'm doing just fine. So what are we looking at when we're talking about core strengthening? What are you doing, or what muscles in particular are we looking to strengthen?
Yeah, we're trying to prevent like excessive motion. So strengthening your transversus abdominis, which is it's kind of like a corset for our core. We got the obliques, the multifidi, the rector spinae. So there's a lot going on in the back.
Flies killed us. So as far as, and then when you strengthen the core, how does that affect as far as to reduce pain or to eliminate pain altogether? What's going on there?
So you're trying to restore neutral spine. If things aren't moving as well as they should, if they are too mobile, if they're hypermobile, or if they don't move well enough, that can create movement dysfunction. And that dysfunction causes the pain. So we're trying to promote a neutral spine by having muscles that support it, so you don't have those painful movements.
Okay. So when someone comes into your facility and they're talking about low back pain, what's a physical therapy treatment regimen? What's it look like?
Yeah, so we're going to kind of evaluate them, see what's going on. I always say the first visit is all about figuring out who they are, what's going on, and how we're going to help them. So we've got to assess how well they're moving or how well they're not moving, and then that provides the treatment direction that we go with. So we'll start off with trying to calm things down, using some modalities, heat, electrical stimulation, ultrasound, using some manual techniques, mobilizations. If it's something more acute, we can manipulate it. Use some soft tissue techniques to try to get the muscles to calm down, because they can guard after an injury and keep things from moving very well.
Okay. So the stimulation, which is referred to as a TENS unit, how does that help?
It helps kind of reduce pain, modulates pain. There's a few different ways, but essentially it kind of helps release endorphins, which are feel-good hormones.
And then the ultrasound, my understanding, ultrasound actually gets into the tissue deeper than the
a little bit of deeper heat.
Okay.
The deeper heat, so we promote more blood flow. More blood flow you have, the better things heal.
And then a lot of times when you have these injuries where the injury is at, it develops scar tissue.
Correct.
What's the problem with when you have scar tissue that builds up? What do you see?
Right. So again, we're movement specialists doing things to move well. Scar tissue is great initially after an injury because it helps kind of provide a little bit of stability. It helps, like let's say you've got maybe a tendon tear or something like that. It helps kind of fill the hole where that tendon was, but it doesn't line up with all the other fibers. It's kind of a jumbled mess. So you've got to get that realigned to promote that good movement position, I guess, for the injury.
So that goes back to my thought too. You think about these professional athletes; they get injured, and they are immediately into some type of rehab, physical therapy. I asked you earlier before about sooner rather than later. Mm-hmm. Again, this part of it when someone comes to see you sooner than later, is it to get that assess what the problem is, get the body moving, functioning properly, but also eliminating or minimizing the fear of scar tissue building up?
Yeah, it can help out that. It also helps to maintain good movement patterns. So like let's say somebody hurts their knee then they stop using it, or they hurt their shoulder and they stop using it. Well, after a few months of not using it, it's going to be stiff. It won't straighten out all the way for a knee, or it won't bend all the way. So, like putting on socks and shoes is going to be difficult. Or if you hurt your shoulder and you don't use it, maybe reaching overhead or reaching behind your back becomes difficult. So not only will we then be treating the injury, we'll be treating some compensatory issues, like limited range of motion, namely. Or if you don't use it, you're also going to have some weakness too.
I see that true, yeah, because when somebody has an injured, again, low back, I see that it affects how they move their gait, which also then it seems like it affects their muscles atrophy because they're not moving properly.
Right.
And then also it seems like they often create, I guess, balance problems.
Right.
Why is that?
Again, movement dysfunction. If somebody doesn't move how they should, they kind of forget. They have to relearn how to walk and things like that. So
the idea is that to get their life back, they have to treat.
They have to get moving.
They have to get moving. Mm-hmm. With that being said, what do you typically see as far as a treatment pattern, as far as how many times a week would they come in to see you?
Typically, we're seeing patients 2 to 3 times a week for 4 weeks is a typical script from a doctor. And then from there, we will reevaluate and see how the patient's doing. And if the doctor sees that the patient's progressing, but maybe he still needs some more, then they can improve more, and that's kind of how that works.
So at some point in time, let's use a hypothetical that the pain's not getting better. What's the next step after that?
The next step could be, maybe the doctor could change medication, maybe do an injection. You always want to avoid surgery, but some things need surgery immediately. But you always want to start with conservative care and then kind of progress as needed, how the patient responds to treatment.
And then you mentioned, too, that you see patients post-surgery. So sometimes, like you said, that unfortunately, the conservative treatment didn't work. Mm-hmm. They have surgery. Say, again, low back surgery. They come back and they see you for physical therapy. What would that look like?
So, like, if they have surgery on the low back, anatomically, the issue is fixed. If there's a disc pushing on a nerve, the disc is out of the way. If there was maybe some stenosis where there's narrowing around the nerve, that's cleaned out. So we don't necessarily have to focus on trying to restore, like, the joint anatomically or things like that. So then our goal is reducing inflammation that happens after surgery. Although the problem is fixed, there's still secondary complications, pain. They have to cut through muscles and things like that. There are some techniques to spare muscles, but you're kind of working on reducing pain and inflammation that are secondary to the surgery and trying to restore the mobility from maybe some stiffness afterwards.
Right. I see that probably when people are in pain, they're guarded and they don't push themselves as far as they need to go to get back to where they were before.
Right.
Part of the process is used. I guess maybe that's the wrong word to use, push, but you're trying to get them to the state that they were before the injury.
Correct. Yes, restore normal movement patterns for them.
Is most of your patients you see pre-surgery or post-surgery?
I would say it's a good mix.
Good mix.
Yeah, we've got some chronic or acute non-op. We've got some people who've had surgery a long time ago and maybe are having some issues, but I would say it's 50-50 of non-op versus post-surgical.
And it seems like nowadays it's really a kind of a multidisciplinary approach. You talked about, you see it from primary care doctors. You also see it from pain management standpoint. All the doctors essentially are working together to get this patient, this person back to health.
Right.
All right, we're going to take a break here. Again, you're listening to Tell Me I Have a Case with Dan Grimm of Cook, Barquette, Ponder & Wolt, and Andrew Below, physical therapist and owner of Advanced Training and Rehab. We'll be right back.